Hello and welcome. You're watching our special show, Coronavirus Facts versus Myths. I'm Gargi Rawat. This is the show where we get you all the latest on COVID. Well, let's get you the latest data that was released by the Health Ministry today. And India has reported 39,361 new cases in the last 24 hours. 416 deaths have taken place during that period. The recovery rate is currently at 97.35%. However, what is causing a little bit of a worry is the fact that after 34 days, the positivity rate has gone up over 3%. So that is something that is being watched very, very closely by experts. Now, if we talk about the vaccination drive, then on Sunday, India gave 18.99 lakh doses of the vaccine. So far, the country has given 43.5 crore doses, out of which 34.2 have received the first dose. And only 9.3 crore have received both doses and are fully vaccinated. Remember, we need to be vaccinating at a rate of 80 to 90 crore a day to cover a significant proportion of the population by the year end, by December. And on Sunday, India vaccinating only 18.99 lakh people. Now, the big focus on the show today, India is likely to start vaccinating children by September. That's what AIIMS chief Dr Randeep Guleria has told NDTV. He emphasized that this will be an important move to break the chain of transmission. This will also be crucial to opening up schools that have been mostly closed since March 2020, the start of the pandemic. So what are the options currently if we talk about vaccines for those between 12 to 18 years of age? Well, the trials for Bharat Biotech's Covaxin on children are currently underway, and hopefully we will have the results soon, maybe even by September. Then there is the Zydus Cadila DNA-based COVID vaccine, ZyCov-D. According to reports, the clinical trials for the 12 to 18 age group have been concluded. Remember, this vaccine, however, is still waiting approval for adults. Then the Pfizer vaccine is being used in various countries, in the US, in Israel, for those over 12 years. Moderna too has been approved in Europe and some other countries for the 12 to 17 years. But right now, there's no clarity on both these vaccines coming to India. There are issues still which remain, like the indemnity clause. Now, there are also reports that early trials of Russia's Sputnik V vaccine among children aged 12 to 17 years have started in Moscow, and Sputnik V is one of the vaccines that we have in our kitty. So that's another possibility in the future when it comes to vaccinating children. Well, to talk more about this, we're now joined by Dr. Sunila Garg, member Lancet Commission, COVID India Task Force, and Dr. Lancelot Pinto, consultant pulmonologist and epidemiologist, Hinduja Hospital. Thank you both for joining us. And Dr. Sunila Garg, first to you, which vaccine do you think we'll get for children in September?
I think basically, Gargi, thank you for asking this question. And children are the ones which have been the focus of attention now for the third wave. Though our seropositivity surveys have shown that the latest sero survey which was released showed that approximately 60% of the children were seropositive. So the first vaccine which we expect is going to be Bharat Biotech. So that is already completed the 2 phases of trials. That means 12 to 18 and then 6 to 12, and then they are going now to below 6 years of age to 2 years of age. So that should be the first vaccine. And I think simultaneously we also have ZyCov-D, which also has applied for emergency use authorization. So that should be also another option which should be available to us. Though Moderna and Pfizer are also being used for 12 to 18 years across, but then they're coming to India is right now full of challenges. So let's see that if indemnity clause is sorted out soon, then we will have more choices of vaccine. But there is no doubt about it that we have to first vaccinate our adults very soon with the number of vaccines available, and we should go to the children till the time we protect our children. Thank you so much.
Right. In fact, right now we're seeing a shortage of vaccines for adults, and we're going to also include children, especially Covaxin, because the production and the supply of that is fairly limited.
Yeah, definitely. You see, right now, but from August onwards, we must have more, supply of the vaccines, as has been pointed out by Niti Aayog also, that gradually as we go ahead, till December, we will have, 135 crore doses of these vaccines. So we will, we would have by that time substantially immunized a fair number of population. And as we can see across the country now, there is vaccine eagerness as compared to vaccine hesitancy. You can see huge crowds. That is where, one thing which has become, positive for us, that people are wanting to take the vaccines, but we have to pay our more focus to our rural and peri-urban areas. But also at the same time, we need to protect our young ones. That means children have to be protected till the time the vaccine is there. And also, you see, I have seen that children who are between 12 to 18, particularly the urban ones, they suffer from, more obesity and all that, you see. So that is where it is important to take that group first, with regard to immunization. But your point is very right, that we have limited supply, but we have to remember in first wave, Gargi, we had only mask, and we protected ourselves with masks. So mask is our very important social vaccine. So I will say that masking, testing, treating, tracking and vaccination, MTV, this should be our strategy for vaccination.
All right, Dr. Pinto, so very welcome news that, we can hopefully expect vaccines for children by September, because we also know that children in households are carriers of the disease. They may not get very badly affected, but they do pass it on to adults and to grandparents.
Hi, Gargi. Thank you for inviting me on the show. I think this is welcome news, especially from interrupting the chain of transmission. I think we need to keep reminding ourselves that children are important mediums of transmission. And although they don't get infected themselves badly, it is possible that they will go to schools eventually, they will get infected, they will bring the infection back home and can spread it to adults. However, I think, a point that Dr. Garg has also raised is that it's the elder children that themselves have a higher risk and not so much the younger children. And I do hope that we don't wait for schools to be reopened till all children are vaccinated, because that would possibly mean another 6 to 8 months. And I think that has a heavy toll to play, especially for the young children, who in all probability will have to wait longer. Most of the approvals possibly will come for the 12 to 18 group first. And if we keep the younger children waiting till everybody gets vaccinated, I think that's a very long wait, and we might have a price to pay for that.
No, if you could explain that further, you're saying that schools should wait till the vaccines take place, or that, children are going to suffer if they have to wait a long time for the vaccines?
I'm saying just the opposite, that right. I really think that schools should not wait till a significant chunk of children get vaccinated, because that would be a very long wait. The priority, in fact, in terms of opening up schools should be for the younger children, because, studies have shown that that's where there's a huge difference in terms of a huge loss in terms of losing 1 or 2 years of education and social interaction with other kids when you are small. The price to pay is very high. And if we come to this conclusion, and that's likely to happen, once we know that vaccines for children are around the corner, there will almost certainly be a conversation about how let's wait for everyone to get vaccinated, let everyone be safe, and only then should we open schools. And I think that would be a mistake. If we really wait for all the younger kids to be vaccinated before opening schools, that might be too late. We might lose out a lot.
Right, that's very interesting, because also, like we've seen in Israel, etc., where they have high rates of vaccination, though children started later, that they did see a spike in cases after schools open, and then that led to, some schools being hotspots and certain measures coming into place. Dr. Garg, your view on that, because we do know some schools have opened for class 10 and class 12 physically right now, and it still remains a choice. Like, it's voluntary, they can continue online if they want. But yes, it's been a huge loss, and especially to children from rural areas, because they can't keep up, with the technology. They can't often do it online, and they've lost out on 2 years of education.
Gargi, there is also another component to it. The children who have to learn to speak, and when you talk to many pediatricians, they will say that, the children have not learned to speak because they have not heard people talking at home, because parents are also involved in the digital world. So they just sign, they'll say like this and all that. They do only lip reading and all. So it is a huge, kind of effect on particularly children who are in the process of learning to talk. So that is where we need to kind of, bring them out of the shells, and it is where we need to open the schools, as has been really rightly pointed out, and we must start with the younger children, as the effect on them is much larger. And second, this thing is that they will suffer from the infection, but then they recover very fast. And
but the worry is that then they'll pass it on at home, and that's what we keep hearing, from experts, that children can, even if they don't suffer, they carry the disease and pass it on.
Definitely, your point is very valid. So this is where comes the importance of, how are we protecting ourselves at home? Even if, our healths, they come from different areas and all that. We ask them to wear double masks. So we have to wear double masks if the children come back from schools and all that. So that's where we have to protect them. And children over 5 years of age definitely can be told to wear masks for a period of time, and the teachers can be vaccinated, and at the school we can maintain a distance, and we have to take care right from the time they leave home to the bus to the sanitization at school and all that. And that's where we have to make a big thing. Like, remember, in US also the schools are open, in England
that's
also,
right.
and so that's where we have to see that, we cannot let our children lag behind, kind of.
And it was very controversial in the US as well. They had a lot of debates, a lot of, heartburn over this issue. Dr. Pinto, it's not something that all parents, will jump up at, because there's a lot of fear as well, and they will want that everybody be vaccinated. On one hand, adults are being vaccinated, so that's some amount of protection to them. Should their children go back to physical school?
So I think the message that really needs to go out strong is that in a household in which you have a child, make sure that all the adults are vaccinated and the children will take care of themselves. I think that message needs to go out strong. That this fear that children are going to be affected really badly is very unfounded. There is nothing to suggest.
That was a very unfortunate, sort of sensational news that happened, and it was just taken. First wave affected the elders, second wave affected more of the middle age, and I don't know, from there the conclusion was third wave could affect children. What was always could and perhaps, but it gets lost in these sensational headlines. So it created a lot of fear among parents regarding children.
Right, that's very unfortunate. And as Dr. Garg has rightly said, the seroprevalence tells us that children reflect the prevalence in adults. So children simultaneously got infected with the adults. It's just that children do so well that a lot of them probably had asymptomatic infections. A lot of them didn't have to be tested because there was no real reason to test, which is very reassuring data that a lot of them probably have some sort of immunity already offered by the past infections. And, as long as the adults at home are protected with vaccination, children by and large will do well. So I think that message really needs to go out strong, that if you have children at home, make sure that you are vaccinated and let the children go to school.
And hopefully the decisions can be made to, open schools and not wait for all children to get vaccinated. And as you said, children are losing out on precious time at school. Thank you so much, Dr. Garg and Dr. Pinto, for joining us. And hopefully we will have those vaccines for children by September.
Thank you, Gargi. Thank you, Dr. Pinto. Thank you.
Now for our special campaign, Vaccinate India, in partnership with Google, where we discuss questions that all of you frequently Google, questions that you look up about vaccines and COVID. And to answer those questions, we're joined by Harshita Surange, member, Delhi Medical Council, regenerative medicine specialist. Thank you so much, doctor, for joining us. And one of the questions that people look up a lot is, how long does it take to develop immunity after a COVID vaccine?
Thank you, Gargi, for having me here. Generally, it takes 2 to 4 weeks after the second shot of the vaccination. That is, in India, we are having Covishield and Covaxin. So after 2 weeks of the second dose, we develop adequate immunity in most of the people. However, it could vary from 2 to 4 weeks.
All right. So a month to be on the safe side, people can assume they have a certain amount of immunity. Even after the first dose of the vaccine, you develop some immunity, but even that is very limited.
That's right. That's very right, Gargi. The immunity is definitely there, but to a lesser extent.
And even though after both doses, doctor, doesn't mean you're completely protected from COVID. You have to continue being careful, practicing all the COVID protocols, mask wearing, maintaining distance, because now there's also the Delta variant, which, as we know, is more infectious and passes on much faster among people.
Yeah, you are very right again, Gargi. In spite of having both the doses of vaccine, we are not 100% immunized. That means that it is not, you will not get COVID infected. You have to have the third dose of vaccination, which means that you have to put on not the third dose of vaccination physically, but you have to maintain all those criteria: mask, distancing, sanitization. All these things are must, because with these and 2 shots of COVID, vaccination is when you are 100% immunized.
All right. And speaking of a third dose of the vaccine, that is something that is being discussed right now, though in India, of course, the focus is on getting everybody vaccinated, but possibly down the line, we'll be told that you do require a third booster shot, or at least for the more vulnerable among us.
That's right. And already some of the researchers have shown that the third dose is especially beneficial for the immunocompromised people. So those who are immunocompromised, they are already being given the third dose because it further enhances the immunity. But for the general public in India, definitely the first priority would be getting everyone immunized by the 2 doses before we think about the third dose.
Right. Another question that people often look up is, can a vaccinated person give COVID to an unvaccinated person?
Of course, that is possible. A vaccinated person, if he is COVID infected, maybe with a little symptoms or no symptoms, he could be just a carrier because he's immunized. So his infection, his symptoms might not come forward, right? So he might be a carrier. He might be mildly infected with not much of symptoms. So he is a carrier and he can very much give infection to a normal person who is not COVID infected. So that is why there comes the role of the mask wearing, sanitization and distancing. Any one of us, whether vaccinated or non-vaccinated, could be a carrier and infect the other person.
All right, and that means that they may have an asymptomatic infection, which is then, a danger to somebody who's not been vaccinated. Doctor, nowadays a lot of people are also getting, the antibody level tested, and they get anxious because they start doing it routinely and get anxious when the antibody levels fall. What would you say to that?
See, basically, it is not required to do your antibody testing. That is just an eyewash. Once you are immunized, your memory cells of the body, they remember the antigen which has been inoculated in you, and every time the new antigen is inoculated or you are infected, the body remembers it and produces the antibody. Not that your antibody have to be present all the time. There's something like memory cells in the body which remember, okay, I have been infected by this particular antigen earlier, so I am ready to produce the antibody the moment I get a new antigen. So it is not actually necessary that you always get antibody titer. But once you are immunized or you had COVID earlier, you are definitely protected to a great extent.
All right, and you needn't worry or keep comparing and counting your antibody levels.
Exactly. You don't need to compare or keep reading that your antibody titer has gone down. Because that doesn't really give you the correct picture.
That doesn't give the complete picture of protection that you have. Thank you so much, Dr. Harshita, for joining us on this topic.
Thank you, Gagi. Good to have you. Good to be with you. Thank you.
Thank you.